Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. I've gotten pretty good at saying that. Excited to be sitting here with someone that I consider a friend, Dr. Spencer Dorn. Spencer is someone that puts out fantastic LinkedIn content, first of all, and has really kind of risen as one of the voices that around digital health and AI that I kind of focus on when I'm passing through my feed. There's a lot of people that I pass over in my feed, and then there's some people that I actually read, and Spencer's one of them. So it's an honor to have you, Spencer. Thanks for joining us today.
Thanks for having me, Mendel.
Let's kind of jump right into your view on the current state of affairs on digital health, and specifically with kind of like an AI lens. There's obviously a ton of hype, ton of false hype, ton of pie in the sky, things being sold. And then there's people that are supposedly doing AI that's not even really AI. So there's like a whole host of AI fatigue inducing things out there. What are the state of affairs in your opinion?
It's a confusing and complicated world to try to make sense of, especially because I think, as you just mentioned, the word AI is plastered on everything. So we use the word so much that it almost loses its meaning. But I think there's a lot of reason for excitement and some relatively near-term opportunities with much broader, larger, long-term opportunities. And I think there's also reason for some healthy skepticism because if we look back at the history of trying to digitize healthcare, it hasn't happened all at once, and it hasn't happened as easily or quickly as many people suggested it would. So yeah, I try and land on that. I'm optimistic. I think it's fascinating, and there are incredible opportunities. At the same time, I think we need to ground ourselves in reality, take a breath and slow down, and realize this won't happen tomorrow, and it won't fix everyone's problems.
Yeah, I agree. And it's interesting because now that we have a little bit of hindsight behind us since the end of 22, when ChatGPT came out and everyone started freaking out about AI. If we go back to that time, there was like this panic that within a couple days, there's going to be these robots doing surgery, and there's going to be, there's just going to be like all these things happening like extraordinarily quickly. And to your point, it's a couple years later, and there's been I think a lot of positive, I don't know about full adoption, but at least a lot of positive frameworks and laying the groundwork for maybe adoption. And I think that we'll probably see some balanced adoption going forward. But do you think it will have the same slow trajectory as adopting, let's say EMRs, which many doctors still are on paper, which is shocking? Do you think it'll kind of have that same slow rate of adoption, or do you think that AI will be something that might be a little bit quicker than that once it actually starts to take?
Well, it's different because with electronic health records, it was really about fundamentally changing how you run your practice and how you practice medicine. So it was in many ways more of a big bang or more of an all or nothing phenomenon where the federal government was saying, we're going to incentivize you strongly to install and meaningfully use, that's where that term comes from, certified electronic health records. And that is a massive change that happens pretty quickly, all at once within months. Whereas AI is not a single thing, right? We discussed like the word is used so much, who knows what it even means anymore, but it's not a single thing. And it's not a fundamental wholesale swap out of how are you operating today and how you will operate tomorrow. I mean, perhaps some would argue over time it will be, but it won't be this big bang phenomenon. So I don't think we certainly do not have the incentive, right? There is no meaningful use for AI. And we don't have the need or the burning platform to change everything all at once. So I think things will unfold at a more measured pace, despite what you may read in different publications or hear online. Yeah.
When we talk about AI, right, there's the actual application for artificial intelligence in, let's say, clinical care, things like that. I think what we're seeing is probably the lowest hanging fruit around kind of administrative functions. And these are things that are kind of slowly being adopted. You see a lot of press around companies like Bridge and Nuance and, Nabla kind of a little bit behind them, but in that same lane, and a couple others as well. DeepScribe, surprisingly, seems to have fallen off the map. Those are kind of like some just general documentation tools and some other workflow tools. So I guess we are seeing some sort of adoption there, and I guess the incentive is, just giving doctors their time back. Do you see that area as kind of a hype cycle as well, or do you believe that some of these administrative assistance tools will be able to give doctors their time back?
I think that there are different frameworks for looking at the potential roles of AI in healthcare, right? It's not all one thing. We have AI. One framework would be to look at AI divided by the purpose of using it. So, for instance, offloading drudgery work, which is what you're alluding to, optimizing resources, democratizing expertise, improving performance. There are different ways that we can harness AI. And that's just one framework. Another framework would be to apply AI based on function. So, for example, to imaging, any healthcare image, the back of the eye, an endoscopy image, a radiology image. So that would be imaging. Another would be prognosticating. Is someone likely to do well or not well? Is someone likely to stay in the hospital a long time, or might they be ready for discharge tomorrow? A third would be diagnostics, right? How do we improve how we make our diagnoses? And the fourth would be treatment. So those are just two simple frameworks that I often rely on for trying to make sense of things. I think what you're getting at, Mendel, is the excitement around a lot of the scribing or the ambient intelligent note writing that's taking off. And there's great rationale for doing so. On the one hand, physicians generally don't like writing notes. They're onerous. They often have to do them after clinic or even, at night or on weekends. And the flip side, patients really don't love their doctors writing notes either, because it often distracts them from looking up from the keyboard or not clicking the mouse or looking at the screen. So it's a nice opportunity to make things better and to apply AI in ways that hopefully can do well. And I think it's great. I think it's a great use case. It's a great application. I would say a few things. First of all, it's not for everyone. If you look at some of the larger studies on this, for example, Kaiser piloted this with Nabla. And they showed that of the 10,000 physicians they rolled it out to, maybe 1,000 or so used it at least once. And the bulk of those 1,000 or so who used it at least once only used it once or twice or three times. Yet there were 100 or so physicians that used it hundreds of times. So just like anything else in medicine, right? It's a tool, and some people will love using that tool and others won't. I, for example, am not interested in using these types of tools because I have generally long visits with my patients. I type very quickly. I prepare most of the note in advance. And for me, the risk of what we lose when we offload this is the critical thinking process. So the actual act of writing a note, just like if you were writing a blog post or an op-ed or anything else, it's part of how we think. So the note writing process, yes, it's kind of a drag. It takes time. Maybe people don't like doing it, but it serves a valuable purpose in that it helps us to connect dots, synthesize our thoughts, clarify what we think is going on, and put it down on paper. So we just need to be mindful that we lose that. Now, the counter argument to that would be most notes are pretty crappy today. Most notes are not very readable. They're extremely bloated. They don't reflect clear thought. So I'm not saying that we shouldn't use these tools because we write these beautiful notes now that reflect clear thinking. What I am saying is that these tools are not for everyone, and we give something up in the process. And we just need to be mindful of that.
Yeah, it's a super interesting point. And, I think whenever you have any kind of big, large advances in technology, you kind of end up with this kind of question. What comes to mind is, I started flight school for a hot 17 minutes. And what I was so annoyed at was that they're having you learn and train on literally the original the original systems that the Wright brothers were using when they made their plane. And then in practicality, and that's what they make you learn the whole thing of. And then in practicality, all pilots are using glass. They're using these, these fancy systems that just basically have a GPS. You follow the line and you're pretty much fine. Right. But it totally makes sense that if those systems go out, you really want to know the underlying mechanics of flying and not just, relying on the new technology. But the flip side, driving tests, all the cars, like when I was taking my driving test, there wasn't really rear cameras and cameras everywhere and sensors and stuff, and you have to turn your head around and know how to reverse and know how to do some of these things. And but yet driving tests are taken with that kind of tech. So it's an interesting conversation of, is it worth losing? Does it matter if you lose it? Because I would say on the one hand, if you don't need to do it anymore and you won't need to do it anymore, then you're just holding on to it for the sake of just in case this technology doesn't work. Like what's the risk of losing? Yeah. Of losing that,
Well, it depends on what you're losing. So I think your analogy to driving or to flying planes is the concept of de-skilling. So you're losing a skill. If you don't learn how to fly a plane without autopilot or the other tools, and you need to make an emergency landing or the system malfunctions, you may not know what to do, and that could be important. On the flip side, it's unlikely your rear backup camera in your car is going to go out. And so I think the question is really what skill are you losing? Critical thinking is probably the most important skill we have. You could argue listening, empathy, compassion, if those are skills. But critical thinking is a skill we can't give up. Now, it comes in different forms, and I'm not saying that if we use notes, automatic note writing, we're not going to think critically anymore. But there's a risk we will lose that fundamental skill or characteristic. A historical example is when I was training in med school, laparoscopy was really emerging as the type of surgery, a preferred surgical approach for many types of surgeries. I remember when I was a first-year medical student, I went to this Cleveland Clinic symposium to see a laparoscopic nephrectomy, a kidney removal. And everyone was just blown away that you could remove a kidney through these little ports with a little camera inside. It was just amazing. And that was 25 plus years ago, maybe 30 years ago at this point. And now if you fast forward, most surgeons do a number of procedures almost purely laparoscopically. So the classic example would be gallbladder surgery, right? In the old days, someone had to have a large incision and they, stuck their hands into the belly and cut and they removed the gallbladder. That way it was called an open procedure. Now it's done laparoscopically. And you could say that's better, right? Yes, it's certainly better. It's much better. Patients go home the same day now. The complication rates are quite low. The morbidity and the mortality from a laparoscopic procedure is much lower than the old school approach. However, sometimes a surgeon needs to open the patient, right? Sometimes that approach is not enough, either because they nick something or they have a complication, or just the anatomy is such, or the gallbladder's matted down in a way that it's not possible. So the question is, will surgeons today who trained after laparoscopy came along be able to do that function? And I spoke to one of my GI surgery colleagues about this. We kind of had a philosophical discussion about it. And he's like, no, you're right. Most general surgery residents do one or two at most open laparoscopies in their entire training. So it is a concern. I'm not saying that we shouldn't. Laparoscopy is the much preferred approach, but we just have to realize there's a flip side, and maybe there sometimes is still value to knowing how to do things the old school way. So long-winded answer, but I think de-skilling is really important. We can't fundamentally de-skill our critical thinking, our reasoning capabilities, but some of the things we do that maybe are more task-oriented, I do think it's sometimes of that, but just realize there may be a flip side, a cost to that letting go.
Yeah, that's fair. Spencer, one of the things that I think is really interesting about you is that you kind of split your time into 3 different groups, if you will, and you're still a practicing physician, but you're also running an academic system, and then you also kind of focus on informatics and things like that. And so I think what's interesting about it is with having your hands both in kind of the research, the R&D side of healthcare and the innovation side of healthcare, but also seeing patients, what is the gap between patient expectations in healthcare and the reality on the ground? And I ask this because I feel like sometimes we hear that patients are, behind where healthcare is, as far as, patients don't want to be, or I guess maybe specifically senior patients, but patients don't are less even digitally involved than where healthcare is. And then obviously the flip side of that is that no, people would love if healthcare caught up to where you would expect 2024 to be. So in with you being kind of in the middle of both, is there a gap, and what does that gap look like?
That's a great question. I don't lead a health system. I'm part of helping, I guess, with a health system, but I lead a large academic practice with many other amazing people. Um, I think the fundamental gap in what people expect and what is actual reality is that people expect healthcare to be more certain. People expect, the general public expects more certainty in medicine, clear answers, clear approaches, clear pathways, easy to measure results. And in reality, healthcare is really much messier, much less certain, less defined than people realize it is. So, for example, I see patients who are suffering from chronic abdominal discomfort or different gastrointestinal symptoms, and they've seen a primary care doctor, and then they see a local gastroenterologist, and they're not doing well, so they get sent to see me, and often they wait a long time, and they may drive a long distance to see me, and many of them show up expecting me to have all the answers. Um, and I try to quickly acknowledge, I'm sorry that this is so difficult. I wish I had all the answers, but I don't. So working through things that way. So I think that's just a personal example that I, in my everyday clinical practice, encounter, but I think it extends much more broadly in that, yes, we do know a lot in medicine. Yes, we are very good at fixing certain things, strep throat, torn AC, coronary artery disease. Yet at the same time, there are major gaps in our understanding of many different conditions. So I think that would be perhaps the first thing that comes to mind when you ask what's the difference between what people expect and what things are actually like.
That's really interesting. Do you think that's mismanaged expectations on the patient's side, or like what do you think that's attributed? Like what would you attribute that to, that misunderstanding?
I think that often people, communities kind of idealize healthcare and physicians and people working in healthcare. Not always, of course. There's the flip side too, where there's some people who think that it's all, none of us know what we're doing. But I think there's an idealization of physicians, healthcare, science. Again, not always, sometimes the opposite. And I think it's comforting. I think it's comforting to believe that there are real answers to all problems, no matter what they are, how complex they are. And so I think it's a combination of maybe not being as familiar with the state of science or the state of medical science, which how can we expect people to be up to speed on the latest treatment of X, Y, and Z? I think that's one thing. And then I think also there's perhaps a hope or a yearning for a sense of certainty, security. I have this problem. I just know that, I go down the street, they're going to be able to take care of me. So it's not to say we can't, it's not to say that just because there's uncertainty and just because we can't, fix everything, that we can't help. It's just that things are more nuanced and there's more shades of gray than what people generally acknowledge and recognize.
Yeah, that's totally fair. And I guess touching on the digital health side for a second, where do you think the gap is, or is there a gap in the use and implementation of various different digital health tools, from anything from like wearables or apps or
Mm-hmm.
Do you think patients are ahead of the game, or do you think they're behind the healthcare system? They're expecting it to catch up.
Yeah, I think it varies. It varies greatly. Some people, ironically, some of the healthiest people who need it the least are really keen on using digital health tools, wearables, apps, different, biometric devices. They just can't get enough. Whereas some of the people that maybe we need to use these or would benefit most from using the tools are completely unaware that they exist, or maybe they're aware that they exist, but they just can't seem to find a way to use them. So I think, with consumer use of digital health tools, I think it varies. I think most people do not use digital health tools, do not think of digital health tools regularly. I think it's probably a subset that are generally highly educated, motivated people who are using them. On the physician side, I'd say it's the same. There are some physicians who just think that they're kind of techies. They love anything anything that relates to digital technologies. They love and they encourage people to use and embrace these tools. But I think they're a relative minority. I think most physicians are probably not either not aware or not necessarily embracing these tools regularly. But this goes back to like the earlier discussion we had about AI. Like, what is AI? Well, what is digital health? Digital health is so many different things. Electronic health records you can consider as digital health. Telemedicine, virtual care, digital health. Remote patient monitoring, digital health. Old school apps, and so it's hard to come to really specific conclusions because it's just a
wide landscape.
It's just a wide range. Yeah, it's as I said, I guess a little earlier, it's kind of messy. Everything's
a
bit messy.
Yeah, interesting. Yeah, kind of like going back to AI, I think just for a second, I think, and I'd love to hear your perspective if this is even practical, but I think of all the things that I've heard about the possible use and application of AI, is in kind of a much more advanced hyper personalization of care, in the actual like diagnostic and care, system. And so being able to like attack, like understanding the individual's like DNA and literally being able to provide care on that level, which I think would go a long way towards maybe that expectation that everyone would love, where you can just answer the question. Well, sounds to me like what you're saying is, well, the problem is it's not so simple. Every human is different to a certain extent, and it's not just, one answer fits all. But if we can maybe make strides towards connecting those two, then maybe we can get closer there. What do you think?
Yeah, I think you're talking about, personalizing medicine or personalizing care, or lifestyles. I think that, of course, that's a beautiful vision. We're all tremendously different as individuals. One person who has high blood pressure may have a completely different, physiologic reason for having high blood pressure than another. Yet we often start with the same medications for both. Or forget about their biology, their social circumstances, the way that they think, the way that they move through the world, completely different.
Yep.
So I strongly believe that one of the core challenges we have in healthcare is that too often we use this one size fits all model where, okay, you have a problem, you wait a bit, you see your doctor may be able to address it with what she or he has available or refer you to someone else. You wait a bit more, you see a doctor who, does a one-on-one visit, speaks to you, tells you what to do, goes home, you go home and you don't see them again for a while. And I think that's just limited, right? There's a reason we do that, right? Because it's easier to kind of mass manufacture healthcare that way, but it's limited. And the vision that you're alluding to is how can we really get to know what's going on with a person biologically, socially, emotionally, behaviorally, and how can we kind of tweak and find the right cocktail, the right approach for that individual's specific needs.
Yeah, exactly.
So I think it's a beautiful vision. The challenge, of course, is for one, we can't make sense of a lot of the signals we can pick up. So, for instance, many patients that I see have chronic, bloating and maybe irregular bowel habits, and they get these stool analyses from, like, they pay for it out of pocket to get their stool
I get those
analyzed.
ads all the time. Yeah.
Yeah. So they bring it into me, and I look at it, and I'm like, I'm actually not sure what to do with this information. Like, okay, you're a little bit higher in this bacterial species, a little low on this. It's not like we understand what that means. So, like, how are we supposed to take it further? So sometimes more information does not necessarily improve decision making. Of course, you could argue that over time we'll understand more, but I'm just saying where we are today. So that's one challenge. The other challenge is that we're generally oriented around providing care a certain way. So you could say, um, let's run a profile on this person, or here's an example. We get a new referral for someone who has condition X, and they have these characteristics. And we know that people with condition X and these characteristics usually do best when they don't need to see the world's expert. They could usually see a PA or nurse practitioner. They don't need to come in person. We could usually see them at home. Usually we like for them to wear this monitor for a little bit. Like, we could kind of create that pathway for people with that type of phenotype or characteristics. The challenge is that most practices are oriented to provide care one way, right? Wait a while, come in, see a doctor. Those are two challenges to personalizing. One is, how do we make sense of the information when there's far more information than we can understand? And two would be, how do we change our practices in ways to be more flexible and more accommodating? An example of this that I love comes from a book that was published maybe about 5 years ago called Unscaled, from the Silicon Valley entrepreneur Hemant. And it's one of my favorite books. He talks about the internet has allowed for something he calls mass personalization. Okay, so rather than mass personalization, and he gives many examples, but one of the examples he gives is Airbnb. So before Airbnb, in the old days, if you wanted to go stay in a hotel, well, you could pick between Hilton and Marriott and the Days Inn. And maybe if you liked Hilton, Hilton had like 2 or 3 different room types. You can get a balcony, you can get a suite, you can get a standard room. But there are pretty limited options. And what the genius of Airbnb, there are many geniuses behind what Airbnb did, but one of the things they did is they can cater to like any type of interest. You want to stay in a treehouse in the jungle, there's an option for you. You want to stay in in a little bungalow by the beach, there's an option for you. So in healthcare, we don't have infinite options, at least not yet. So if we want to personalize, we need to better understand the information we're being presented with, and we need to craft more options.
Yeah, it's a great answer. Kind of tying it all together, between the 3 things that you spend your time on: looking to the present, looking to the future, looking at innovation, and looking at where the patient experience is. What's the thing that you're most excited about for the present future of healthcare?
Healthcare is it's in many ways our healthcare system struggling. Those we serve are not necessarily thrilled with what we do. Right? People have to wait a long time to see a clinician or a nurse. They may not be happy with the amount they need to pay, both for their premiums, but also to see someone. They may not be happy with the encounter and the experience. They may not be happy with the results. So that's one challenge. And then the people working in the system also feel oftentimes beaten down, worn out, sometimes even burned out. So healthcare is just in a tough spot, I think, coming out of the pandemic, in the current world where we expect everything to be on demand and fast, and we're overloaded with information. So we need help. We need help badly. I think technology is part of the solution. It's certainly not all the solution, but I think there are some technology tools that can help us do things a little bit more easily and effectively and efficiently in ways that both those we serve and those providing the care appreciate. So I think there's some benefits there. I think there's also potential drawbacks we need to be mindful of. But I think ultimately what we need more of in healthcare is connecting back to purpose, connecting back to what is the meaning of what we do, why do we do it, what are we trying to do, what are the intrinsic rewards we get from helping other people, having amazing colleagues? So, I mean, maybe that sounds too nebulous, but I think we need to find sources of renewal, almost on a spiritual sense, certainly an emotional and a practical sense. And those would be two things that come to mind.
That's awesome. Nice.
Yeah.
Well, Spencer, this was a lot of fun. I know we can go on and on, but
Yeah.
you know, I wish you continued success in all three of your endeavors. And thanks so much for spending time with us today.
Thanks so much, Mendel. This was fun.